Well, folks, it's really such a pleasure to tape this podcast today with Katie Coleman. We have not met in person yet. Hopefully, we will. We met actually on social media. And if you listen to me right now, you can tell probably that my voice is not 100%, but it doesn't matter. Healthcare Unfiltered always has to keep going day and night in sickness and health. I've invited Katie on the podcast to talk about her journey as a patient who was diagnosed with cancer, literally probably about the time when we were going to be hit by the pandemic, and really to illustrate her journey and then how she emerged on the other side as a warrior, as somebody who is really going to treat the cancer as just simply like any other illness. It's not going to really stop your ambitions. Katie, welcome to the show. Maybe just we'll start by letting people know who you are, where you live, well, whatever you want to tell us about you. Don't say anything you don't want to say. I was going to say where you live, but then maybe you don't want to say that.
Yeah, I appreciate that. Thank you for the opportunity as well. So I'll kind of give the backstory of how I got diagnosed. I was diagnosed with a very, very rare stage 4 kidney cancer on New Year's Eve, 2020. And it happened to be just 2 months after I got married. So my diagnosis kind of started probably a little bit before that. I'd been feeling off for about 1.5 years. I had tachycardia, I had a rapid heart rate, I had high blood pressure, and a couple other symptoms that I was trying to track down with doctors. And everybody kept just telling me that I had anxiety. And there was at one point I had kind of had some like hair thinning and I just wasn't feeling well and was wondering, I even asked if this, like, could we rule out cancer? Could it be caused by cancer? Why I'm feeling off and having all these things. And I was told I was too young for cancer. And so that kind of just.
How old are you? Were you?
I was 29 years old when I was diagnosed. I'm just about to turn 31. And so I was like 27, 28 as I was going through this process, and nobody expects the young 27, 28-year-old to be diagnosed with cancer. And so I kind of was going through a bunch of different processes and testing, and I had a heart rate monitor and stuff like that, and just kept being told it was anxiety, but I felt kind of deep down that something was wrong. And so I was moving, my husband and I, like I said, we had just gotten married in October and we were building kind of our dream home for our future family. And I was in the process of changing primary care physicians and was seeing a new doctor. And I had pointed out to her that I had started to feel a hardness in my upper right abdomen. And I asked her if it was anything to be worried about. And she told me that it wasn't kind of anything to worry about at the time. And I just didn't feel right about it. And so I went to an urgent care, I think either later that day or the day after, to ask them about it. And they, in the urgent care, were feeling around, because at the time I thought maybe it could have been like an enlarged liver. I don't know. I was whatever Dr. Google was telling me at the time. And the urgent care thought it could possibly be an enlarged liver. So they had sent me to the ER to get it checked out. And this was kind of, like I said, this was New Year's Eve 2020, and it was kind of the height of the pandemic at the time. Cases were at an all-time high. And I was really nervous about going to the ER because I felt like I felt well physically for the most part. This was just like a weird hardness that I was feeling. And so I ended up going to the ER anyways. I called my husband and said, I just don't feel right about this. I think I'm going to go to the ER. I think he came down. I can't remember if I went back home or if he met me there, but he waited in the parking lot as I went in to the ER and was getting triaged and everything. But I remember as I went in, I felt really bad because there was a patient outside of my room when I was taken back to a room. And I remember feeling like, oh man, like there's not enough rooms for everybody. And like, I feel fine. I'm here for no reason. I felt like, oh man, I shouldn't be here. But I remember everybody assured me like, no, you should be here. So they went through the process, they felt the hardness and decided to do an ultrasound. And then they wheeled me back into the ultrasound tech. And that's instantly where I knew something was wrong. The ultrasound tech was super bubbly when I walked in, and we were kind of like chatting back and forth, and I laid down on the bed. And then as soon as she got the ultrasound on me, her face just dropped. And like halfway through, she like let out a big sigh, and poor woman was trying to do everything she could to like keep composed and not show me that she was kind of stressed by the situation, but I could definitely tell she was. What she was seeing at the time, I don't know if you can see this, but I had a 3D rendering of my tumor printed. And so this is after I had already responded to treatment, but this is what she had seen in the ultrasound. It's massive. It was 12 centimeters at the time I was diagnosed. And so she found that in the ER. That obviously sent me, they also saw liver mets, what they thought could be liver mets at the time. So they sent me to CT in the ER. And then CT kind of confirmed that we didn't know for sure. Obviously, we weren't going off of a biopsy or anything like that, but I had pretty extensive liver mets and a very large tumor on my kidneys. So they thought kind of there in the ER that I would have stage 4 kidney cancer. So the next few days after that, like a total and complete shock, because I had never met anybody diagnosed with stage 4 cancer. I've been very fortunate that most of my family hasn't ever really struggled with cancer. I didn't have any relatives that ever had stage 4, certainly. So anything I had ever seen from cancer or anything like that kind of came from the movies and hearing about people kind of passing quickly with stage 4. So I spent those next kind of days kind of petrified, to say the least, and kind of at a complete 180 from where I had been at building our house and everything like that. So I don't know how much further you want me to go from there, but
yeah. Did they set you up for a biopsy?
Yeah. So
how long
that was the next step. Everything kind of felt pretty delayed.
Yeah, how long did you wait before you got the biopsy done?
Yeah, so everything kind of felt delayed because I think it was a combination of both things. One, I got diagnosed on New Year's Eve, and so it's obviously the holidays, and a lot of people were out of office. I think it was about, I want to say a week or two before I got the biopsy and kind of had those first, actually it was 2 or 3 weeks before I had the biopsy. I had gone for an MRI and my first appointment was about a week or a week and a half later. But they got me set up with an oncologist. I was living in Utah at the time. So I went to Huntsman Cancer Institute originally. And they had set me up with an MRI for my liver and the abdomen. Because so my tumor I have a really, really weird type. It's a metastatic oncocytoma, which if anybody knows anything about kidney tumors, they always say that I'm misdiagnosed. But I've seen the top specialists. I've gone to MD Anderson. I go to the National Cancer Institute. On my scans initially, my kidney tumor had a giant central scar that's seen in oncocytomas. And so we did an MRI before doing a biopsy in case it could help rule out maybe benign lesions in my liver, in which case we would have just taken the kidney tumor out and I would have been fine. But
so they biopsied the liver to check that what's in the liver is related to the kidney. And the idea was if what's in the liver not related, they could take the kidney out.
Yes. Yeah. So once we did the MRI, they couldn't determine if the lesions were metastatic or not. And so we decided to go ahead with the biopsy, and we biopsied both my kidney and my largest liver lesion, which was like 6 centimeters in my liver.
Okay.
And so they both came back. They technically came back as an unclassified oncocytic neoplasm. Since oncocytomas aren't ever split, but they did match, and that confirmed the stage 4 diagnosis.
So you went from in November 2020, where you really did not have any diagnosis and you were not feeling well, you were building a home, to now February 2021, where you have stage 4 cancer of a rare tumor of the kidney that has spread to the liver.
Hmm.
What do you do?
Yeah.
What do you do next? I mean, did you see somebody to see what the treatment options? What happens next?
Yeah. So when I was first going through the diagnosis process, like I said, I'd been kind of tracking down some issues because I hadn't been feeling super great. So I was trying to track things down, but I didn't have a lot of involvement through the healthcare system. I hadn't navigated very much, so I didn't know what to expect. But I went from my biopsy, I went and met with my oncologist, and they suggested a treatment plan. I think we were going to do a TKI immunotherapy combo originally. But when we found out how rare the type of tumor I had was, I can't thank my first oncologist enough because I was talking with him about it and kind of just let him know, like, hey, I've heard this is kind of rare. Like, do you mind if I go for second opinions? And I know not everybody's always comfortable with that. And he definitely was comfortable. So I went to MD Anderson, decided to do a second opinion there. So my husband and I flew out. And that whole process, I mean, the whole process of going through and being diagnosed was crazy in COVID in general. My husband couldn't come in with me many times. He actually was in the room with me when I got diagnosed with stage 4, which was nice, in the ER. But like all my appointments at MD Anderson, he wasn't allowed to come with me. And so it was a very odd experience to try to navigate a diagnosis like that.
I've actually been very vocal about this, that this was very, very wrong in terms of how people handle the pandemic. You know, when you are sick with something, your family member can wear PPEs and can actually get in the room. The idea of not having anybody with you in the room when you are most vulnerable and your health is being affected, in my opinion, is absurd.
Yeah, it was definitely very difficult to navigate. Like I had my husband on FaceTime for all the calls, but obviously it's not the same. He actually came with me for the first time last month. It was the first time he had come with me to MD Anderson and actually got to be in there for my appointment. And so I told him it's kind of weird that I'm like a year and a half into this, and this is the first time he's like actually meeting my oncologist, which was kind of a weird
So
experience.
what was the treatment that they recommended to you?
Yeah. So when I got a second opinion from MD Anderson, they kind of thought the same thing. It looked like a metastatic oncocytoma, but they couldn't technically call it that.
Why?
And
Why couldn't they call it that?
the like the description of an oncocytoma is they're supposed to be benign, and so there's some controversy on if you can call a tumor that looks like an oncocytoma if it's spread to the liver and become metastatic.
Got it.
So, but everybody I came across basically told me this thing looks exactly like an oncocytoma. We just technically can't really call it that. And so the treatment plan, they weren't really sure of. There's another rare type of kidney cancer called chromophobe kidney cancer that we were kind of modeling my treatment after, which there aren't a ton of treatments available that work really well for chromophobe currently. And that's something that I actively help raise money for and research. But we were going to go with an approach that had worked on some other chromophobe kidney cancers. And so MD Anderson wanted me to start on a TKI, or like a chemo pill, sometimes they call them. And so I started on Cabometyx in March. Early March of last year. And I was on that treatment for about 2.5 months.
By itself?
Yeah, just by itself, no immunotherapy. They suspect that due to my tumor type that I might not respond to immunotherapy. Obviously, nobody knows. Like the type of tumor I have is extremely rare, like under 5 case reports worldwide in history. So nobody really knows for sure, but they suspect that it might not respond well to immunotherapy.
So you were on Cabometyx for a couple of months, but then they stopped it because they stopped working?
No. So through this time, um, I always wanted the tumor out because it was huge. I could feel it in my abdomen. Originally, when I was diagnosed, everybody told me that surgery was impossible because I had too many liver mets and because I was already stage 4, that it wouldn't help or prolong my life or anything like that. And so the goal of treatment early on was purely to extend my life as long as possible. And that's what I was on Cabo for. But I just knew what I had was really rare. And so I kept kind of always searching. And in the back of my mind, I just always really wanted the tumor out. Like I would even lay on my side. It's actually funny to think back on before I got diagnosed, like the summer before I got diagnosed. I had lost a bunch of weight because I was exercising and eating healthy to try to kind of solve my own problems. And I had lost some weight and I was laying in bed one day and I said to my husband, like, isn't it crazy? Like when you lose weight and all of a sudden, like your ribs poke you when you lay down. And he gave me this look like, no, ribs aren't supposed to poke you when you lay down, but I kind of just brushed it off. But I now realized that was the tumor that was poking me. And so it was uncomfortable. I always wanted it out. And so I always kept looking for other options. And one day as I was browsing on social media, because after I got diagnosed, I became quite active on social media and in different cancer groups and speaking with other patients. One day I came across this post that somebody had posted on another patient's page that I was friends with of a bright orange GTR that was raising money for rare kidney cancers. And I, at the time, before I got my new job, I had worked in motorsports. I built software for racetracks and had worked at different racetracks for 15 years. And so thought it was kind of crazy, this bright orange GTR raising money for like the extremely rare type of kidney cancer that I had, not mine specifically, but another rare type. And so I reached out to that organization, just kind of hoping to connect networks and raise money for kidney cancer through our common motorsports networks. And as I was talking to him, that organization was called Driven to Cure. And it was founded by a young patient named Andrew who had HLRCC, another rare type of kidney cancer. And his dad was running it at the time. And as we were speaking, his dad found out how rare my type of kidney cancer was. And so he decided to put me in touch with the top experts in kidney cancer at the National Cancer Institute, the National Institutes of Health. So after we got off the phone, he sent an email to Dr. Linehan at the NCI. And I had an email in my inbox the next morning from them saying that they were interested in taking a look at my case and that it would move to a surgical route might be possible through them. So I was on Cabo for 2.5 months until I kind of went through this transition and got in touch with the National Cancer Institute, where my treatment plan changed to a surgical route.
So change to surgical route of the primary tumor.
And the liver mets.
Well, how many liver mets did you have?
About 20, which is crazy.
They can't take 20 liver mets, can they?
Yeah, so not quite. Nobody else would have touched me for this surgery. And I'm extremely grateful for the NCI and the fact that they were willing to take a risk on me. Especially because I'd been told at least 5 other times that surgery was not possible.
I get the resection of the primary tumor. I think, that is different, but I think how could they resect 20 liver mets?
Yeah. So when they looked at my scans, my tumors were all kind of, they were kind of encapsulated in, I don't know if I'm describing that correctly, but they weren't super invasive into the liver and going into the tissue around kind of just these little circle lesions that I had. And so I had like 4 larger liver mets. One was 6 centimeters, and then they went down to about 1 to 2 centimeters. And then I had a bunch that were about a centimeter or less. And so in my initial surgery, we took out my right kidney in the primary. We did several wedge resections of my liver, which I think got about 10 of the tumors. And then we ablated 5 tumors in that surgery as well. And then when I had my follow-up scans about 3 months later, that's when they realized that there was a few tumors that were like 1 centimeter or less. Most of them were around like 3 to 5 millimeters that weren't seen during surgery. But they didn't think they were new. They were on my scans the whole time. They just weren't seen because they were so small before. And so I still had those. We went back and ablated some of those in November. And then I'm still watching some. So that's why I'm not technically in remission right now, and still stage 4, because I still have some liver mets.
That's November 2021.
Yes. Yep.
So you're not getting any treatments right now in terms of pills or anything. You just had what I would call it radical surgery.
Yeah.
And ablation. And then now they're monitoring you.
Yeah. It's a very, very unique situation. It's kind of weird. I always kind of think of myself as like, I consider myself both the luckiest and kind of unluckiest person in the world, because I had this benign tumor that was never, ever supposed to spread. And that's pretty unlucky. But at the same time, a lot of other patients wouldn't have qualified for the surgery that I did.
It's possible because it's not considered very malignant. That's why they thought removing it surgically and ablating it might actually help.
Yeah.
Katie, so now you're on a monitoring phase, and I hope this lasts for decades. But when did you decide that you want to share your story on social media? Because I do think that it's no easy task to go on social media and share such a vulnerable and private information with the entire world. Take me through what made you make that decision, and how did you do that, and were you afraid of the reaction?
Yeah. So I started sharing very, very early on in my diagnosis. I literally made a post, I think like the 2nd or 3rd day after I knew I had cancer, and asked folks to help me name my tumor, to help try to like put a positive spin on things and try to find something to keep me more upbeat about. But I decided to share because, so I'm very introverted and I was a very private person before my diagnosis. But when I got diagnosed, as I mentioned before, I didn't have any experience navigating the healthcare system. I didn't know anything about cancer at all. All I knew is like what I'd seen in the movies, and stage 4 was terrifying. And I didn't know what to expect. I didn't have anybody to talk to know what to expect. And so there was 2 reasons I started sharing. The first was I decided right after I got diagnosed in December, I was going to share everything I was going through, what the scans were like how many times I was having to get labs done, what the biopsy process was like, everything online, so that
what was your goal of sharing though? Like what was,
yeah.
what were, as you share this, what were you trying to hope accomplish?
Yeah. So my goal with that was that if anybody came behind me who got diagnosed and also didn't know what to expect, that they could almost have a blueprint or an example to look at to say, okay, this is what I can expect for an MRI, and this is what I can expect for a CT scan, and just kind of to help share that whatever the process was going to bring, what that journey looked like, especially because I kept hearing over and over again that like, continue to live your life with cancer, and people live their life with cancer. But I hadn't visually seen that happen.
Easier said than done, right?
Yeah. And so I wanted to give an example of that. The other reason was because what I was diagnosed with was so incredibly rare. There wasn't any information for me to go off of. I also decided to share. That's also why on Twitter, like I post my full medical records. I've got pictures of my tumors up there, all my pathology and slides.
Were you nervous that you were working at the time? I think you said software.
Yeah, software engineer.
Right. Were you nervous that your employer is going to see that and the possible reaction to this?
I wasn't. I was in a very, very fortunate spot with that. The company I was working for previously, I had been there for about, like 6 years at the time, 6 to 7 years at the time. And it was a startup when I joined. I was a very, very early employee. And so I had a really great relationship with the founders and all of my coworkers. And so I told them immediately when I was diagnosed, and I felt very supported. I did have a phase where I worried that, like, because I was stage 4, I was going on short-term disability so that I can move to Texas to be closer to MD Anderson. And I was worried I wasn't going to be able to work again and that they wouldn't want me to come back. And I was a little bit worried about what that would do to my career going forward.
Were you living by the NCI or in Texas? Where were you living at the time?
So I was living in Utah. And then once I got diagnosed and started treatment, I moved down to Texas. I live in Austin, but I was going to Houston for MD Anderson.
Sure. So you shared that with them, and you could probably appreciate that maybe there are some other patients who may not have a very supportive work environment.
Yeah.
I think you're fortunate that your colleagues at work, they were very supportive and so on. But then you made a decision to switch careers.
Yeah.
So how did this?
Yeah. So that was kind of a crazy transition for me. And it was something that I thought a lot about. And I definitely was much more concerned about my diagnosis with a new job or a new employer than what I was coming from. But as I was going through this process and kind of navigating the healthcare system as both a patient and a software engineer, there was this part of me that would get so frustrated by some of the inefficiencies in healthcare and kind of the lack of tech in healthcare. And one of those for me, because I have such a unique case, is I have lots and lots of physicians and everybody uses a different EMR. Somebody's on my chart, somebody else is on a different system. And so I had this giant binder that I was using to keep track of, like, all of my doctors, the nurses' lines, medical record numbers. And it was extremely hard whenever, like, I had a side effect that I needed to report, or I needed to get new records over to somewhere else. Tracking down all that paperwork was hard. And so I, right before I went in for my ablations last November, I decided to build an app for myself to manage all of that. And I basically built an app that allowed me to keep all my providers all in one place, put my notes in there. And then I eventually added several features on later down the line. But through that process, as I was working on this app, I kind of realized that I had much more of a passion to build software that could help other patients and help them navigate the process a little bit better. And so I decided to go part-time at the job that I was previously at, so I could spend more time focusing on building software for patients and building content online and just kind of sharing and helping other patients. And so I kind of transitioned. I didn't expect to go back to work full-time as quickly as I did. I wasn't looking for a job. But I told myself, if the only exception to me going back to work would be if I had a company in the healthcare tech field reach out, that I would kind of entertain the idea of going to work, because I wanted to build software to help patients. And so that opportunity kind of presented itself, and I took the transition from there.
So as you took that transition, I mean, having a new job, a new career while you're diagnosed with stage 4 cancer, regardless of where the cancer is coming from, must be pretty unnerving. I don't know how the process works in terms of an interview, not an interview. I don't know how this actually happened, but I presume you shared all of the information with your employer, prospective employer. Number one is, were you worried that this might affect your opportunity to get the job? And number two, going back to when I first started the episode, that's really what initially struck me in what you posted, because a lot of people were a little bit surprised that you are switching careers while you're being diagnosed with stage 4 cancer. And I think you went on social media and said, just because I have stage 4 cancer does not mean I just sit home and don't do anything. Take me through those two events.
Yeah. So I definitely was nervous about going to a new employer because, they can't discriminate against you because you have stage 4 cancer explicitly. But of course, like going into a diagnosis,
they can come up with another excuse.
Yes, exactly. My first thought was like, okay, well, like the minute I tell anybody, they're going to say, oh, okay, well, why would we want to employ somebody that we don't know how long they're going to be here? And so, like I said, I was in a very, very unique situation. I realized how fortunate I am because I didn't need to work full time. I kind of had another job. I was working part-time. And so that gave me the opportunity to test this theory of being transparent and how that might work. And so the recruiter reached out to me, and I never respond to recruiters. I have tons of recruiters in my inbox and I never respond to them, but I randomly decided to respond to this one. And I basically planned to tell them like, thanks, but no thanks, because the only positions I'm really looking for right now is if there was something in the healthcare tech field. And he had let me know that this position was for a company kind of in the digital health space. And so as I emailed back and forth with him, learning more about the position, I was straight up front right out the gate with the recruiter because I decided if this was an opportunity I was going to take, I was going to lead with my diagnosis so they knew kind of what to expect from the get-go. So I just told the recruiter up front, I said, hey, like I have stage 4 cancer. Like, here's my backstory. I don't find it as a weakness. I think that's what I mentioned in the tweet. My diagnosis has empowered me and given me confidence in a way that I didn't have before I was diagnosed. And so I see it as a strength and it pushes me to want to do more and live life longer in the best way that I possibly can. And so I led with that right out the gate and let the recruiter know. And it wasn't an issue with the recruiter. And when they had spoken with the company as well, it wasn't an issue with them. And so they wanted to kind of proceed through the interview process. But I was transparent with everybody I spoke to through the process, kind of leading with that info.
What was the reaction that you received on social media when you actually kind of told people that you are starting a new job, new career, and just take me through the reaction that you've received on social media? Because frankly, you and I know, we can't control social media. There are plenty of good people and plenty of bad people. But I think in your situation, what's pretty interesting is, did people embrace it? Did people were shocked? Because I want to take from here and talk about survivorship a little bit. Tell me the reaction you received on social media.
Yeah, so it was both. The majority of comments were very supportive and very kind, and people kind of encouraging me. But there was kind of the other half of the comments were people telling me not to disclose my diagnosis, that I'm making a mistake, that I'm going to lose my health care, or that they're not going to want me if I have cancer. There was also several comments that almost implied that like I was a charity case and that I only got the job because they felt bad for me.
I see.
Which, like, I'd worked very hard on my career and I taught myself how to code and become a software developer. And so sometimes those ones felt a little bit like, no, I actually I put in the time to build this career for myself, and that's what the backing is on. But there definitely was a mixed response. But behind all those comments, I could see why there was a mixed response. A lot of those comments were from patients who had been discriminated against, which was very hard to read and see. Like it breaks my heart for the other patients out there who haven't had my experience, who have disclosed their diagnosis to an employer and either been let go or torn down for a position. So like I said, I had a very unique situation, but I realized that's not the case for everyone.
But in essence, really the underpinning of all of this is that such a diagnosis should not put a pause on life.
Yeah, definitely.
And I think by you moving forward and getting a new opportunity and a new career, you've really illustrated that. You hear a lot in the field of cancer about survivorship programs and survivors and so on. As somebody who was diagnosed with a rare tumor, stage 4 tumor, and so on, what does that term mean to you? And what's your impression about these survivorship programs that you hear about?
Yeah. So I haven't ever been a part of like survivorship programs specifically, but I'm very involved in like patient groups on Facebook. And honestly, part of that is what led me to even have the courage to go for another position. I'd spoken with other patients that had stage 4 cancer, and some of them had switched careers, or I'd watched them go through the process of a new job. And so I think watching them go on and live their life set an example for me, because I certainly wasn't always super positive when I first got diagnosed, especially those first few months. I was very down and depressed, and like felt like my life was over, even though I was kind of going through this process. And so I think kind of the importance of survivorship is sharing our lives. And that's why I share so publicly, is because knowing that as a patient newly diagnosed, I was looking to other patients to see how they were living their lives, and watching them carry on with their lives regardless of their diagnosis. And so,
but survivorship, oftentimes people equate survivorship with the time from finishing treatment.
yeah.
And I think obviously you're an example why this term is flawed, because you still have disease, but you are a survivor. And I think before we went on the air, you did mention that the term survivor was initially was a little bit uneasy on you. Can you elaborate a little bit on that and how you viewed it?
Yeah, definitely. So when I was first diagnosed, I remember hearing the term survivorship, and it honestly made me really sad. I didn't like using that term for myself. I almost felt like an imposter anytime, like I said, cancer survivor, because as a stage 4 patient, you have cancer in your body. And most of the time with stage 4, like it's not expected that disease, you want to slow it. But there's not a lot of cures in stage 4 cancer. And so I always felt like I'm not a survivor because I still have cancer in my body. And over time, that description kind of evolved for me. And I did realize that you're a survivor kind of from the day you get diagnosed. And survivorship is about living your life, not necessarily being disease-free.
Yeah. And I think that's really important. I think some of the reaction you got on social media saying like, why are you doing this? You already have stage 4 cancer. Why are you doing this? And I think you basically said, screw you. I'm going to do this because I'm going to live my life.
Yeah. Yeah. And the response that I get a lot too is people always ask me, why are you working? Like, if you have stage 4 cancer, why are you working? And I would be off on a beach somewhere enjoying my final days. And I really struggled, honestly, early on in my diagnosis with the same thing, wondering like, okay, I have stage 4 cancer. I should be off spending all my money on these vacations, checking off my bucket list and doing all of the things. But those things were stressful for me, especially in the middle of COVID, with flying and doing all these things with an active cancer diagnosis wasn't exactly ideal. I started to really focus on what made me happy. And I've always loved to learn new things. I've always really enjoyed working. And so to me, survivorship means doing what you want to do with your life. And for me, that's working and doing things that I feel are contributing to society. And so that's why I choose to work instead of spending my time on on a beach vacation somewhere kind of thing. It's what I like to do.
But you still have to take a vacation. That's an
Yes.
order.
Yes. All right. I will.
I mean, for the most part, really the reaction was positive. I mean, they've embraced your decision and so on. How would you categorize or classify your experience on social media in general? I think there are pluses and negatives, but as you have been on social media, what would you say this was a positive thing, negative thing, neutral?
Yeah, it's absolutely a positive thing. Social media completely changed my life with my diagnosis. I wouldn't be in the position that I am right now, not on treatment, if it wasn't for social media. That's how I found Driven to Cure. And that's how I got to the NCI and got to surgery. And so I accredit social media with a lot of that. It's kind of odd being in my position because when I tell people I share my story on social media, a lot of people don't like social media these days, and there's a lot of negativity around social media. And I don't see a lot of that as a patient. I do have people that post negative comments every now and then on my posts. But for the most part, I'm on a side of social media with other patients that is very uplifting. Some of the other patients I've met are just incredible support systems for each other. And so it's been very, very beneficial for me. And it's, I think, a completely different side of social media that a lot of people kind of just interacting with their everyday lives are kind of interacting with. So for me, it's been very positive.
So what's next for you? How often do you see your doctors now? And you don't go to the NCI anymore. You're just at MD Anderson. So how often do you go? How often do you travel from Austin to Houston?
Yeah, so I'm kind of at both still. So my next set of scans will be at the end of June. So we're doing surveillance scans every 3 months to keep an eye. We have some spots that we know were too small to treat during my last ablations. And so we've just been watching those. They've been stable for 6 months now, I think.
That's great.
About 6 months. So we've just been watching them. The plan is to probably ablate those if they grow at any point. So in June, we'll rescan if there's any growth. After each one of my scans, MD Anderson looks over and reviews everything, but so does the NCI. Right. And if it grows, the NCI likely will be the ones that do the ablations, since they did the original surgery and kind of know where everything's at.
Right. What's maybe the last question I have? You were diagnosed, treated, and so on during once in 100 years pandemic. How, I know that's like a very, very, very broad question, but maybe in few sentences, what was the impact of COVID-19 on the entire journey?
Yeah, it was really hard as a patient. Not having my husband there, again, for kind of all of the bad news that you receive as a patient navigating a cancer diagnosis was really hard. And then even some of the little things that you don't think about, like when people get diagnosed with cancer, you want to be supported by like your friends and family. And right after I got diagnosed, like I couldn't see them. Like my family dropped off like a care box to me and was shipping me stuff because we have a large family and we didn't want to do like big, large family get-togethers around my diagnosis. And so that was very hard to navigate, not be able to have those really close relationships, go to like big family parties and stuff like that I normally would have been going to, as well as I had to plan my life kind of around my scans and treatment because I didn't want to catch COVID anyways, but I also couldn't catch COVID and delay a scan or a treatment that I had upcoming. So I was going for, in the beginning, I was going for appointments like every 2 to 4 weeks. And so if I caught COVID, that was going to have to be pushed out by 3 weeks anytime I caught it. So definitely meant a lot of just staying at home and hanging out with my husband and a lot less social interaction to kind of get through everything.
Look, your story is really inspiring. I think the two take-home messages that I took from the story. Number one is, survivorship is not at the time of finishing therapy. Survivorship doesn't have a time limit. Basically, people need to hopefully live their life and, like you said, do what they actually feel is important to them. And number two is that. I think the positive reaction of sharing very intimate details of a very difficult illness, you know, you put your vulnerability on the line, and I think again from listening to you, did that to help other people, and that's really commendable and is very helpful because I could imagine that there are people who just feel uncomfortable doing that. But you said, you know what, I'm going to do that. It's probably going to help somebody. And I think you also got lucky with the employers that you had because you were
Absolutely.
able really to maintain your job originally and you found another job and there were really no issues. Lots of stories here.
Yeah. Yeah, definitely. I consider myself, like I said, I feel very, very fortunate to be in the position that I am. Um, I know my journey is different than many other stage 4 patients, but we're all kind of along the same journey. Once you get diagnosed with cancer, it's all kind of the same process as you go through. But I do realize what a unique situation that I've had, and I try to do whatever I can to try to give back to other patients because of that, because I know I could be in a very different situation right now. And while I feel well, I should be giving back.
Is there anything else I should have asked you about that you think is really important to share with listeners and viewers? We will have this on YouTube as well as on the podcast outlets.
I don't think so. I think my biggest thing that I always worry about when I share my story, just because I have had such a very unique diagnosis and treatment plan, is just that I am in a very unique situation, and every patient's journey and treatment is very different. And so it's always really important to evaluate your current situation. I was able to take these risks because I was in a unique situation where I didn't need a job. And I always encourage patients to use their diagnosis and try not to think of it as such a negative thing all the time. Like I said, mine really empowered me and gave me a strength that I didn't think that I had before. But at the same time, make sure you're conscious of you're in a safe place to share that information. There's, like you mentioned, there's some employers that wouldn't be supportive in situations like that. And I always want to make sure that I support patients where I can, and sharing my life. But at the same time, I want to make sure that everybody knows that they have individual treatment plans. And
so my last question to you is, as you see doctors on social media interacting and sometimes arguing, sometimes screaming at each other, sometimes, being silly, all of these things. As a patient, what is your reaction to the med Twitter or onc Twitter or what you want to call it? What's the good, bad, and ugly, I guess?
Yeah. I personally love it. But I think that's because there's a few things that you might see on there sometimes that as a patient, might be hard to see, maybe talking about overall survival stats very kind of nonchalantly, I guess. I don't know the proper term that I want to use there, but kind of matter of fact can kind of hurt when you're the patient with that diagnosis. But I love my Twitter. I mean, I share all of my scans, my slides, everything on Twitter because I want other people to be able to learn from my case. I figure what's the point in having a rare case if somebody can't learn something from it. I like it. I love the fact that so many doctors are out there collaborating with each other, even if they're not always agreeing on things. I'm not somebody that thinks everybody should agree on everything all the time. I think that you learn more and you push yourself by having opposition. And so
I do think it's important, though, that physicians recognize that patients do see that.
Yes, that part is
be sensitive to patients' needs. Language, words matter. on
Yes.
social media, and you could be that patient that is watching this. So I think, like you said, this blunt use of certain terminology may not always really sit well with patients, and I think it's very important for us to recognize that.
Yeah, I especially think like sharing patients' cases online, especially if patients don't know that they're being shared, but they can identify themselves, even if other people might not be able to identify them. I'm in a situation where those things don't bother me, but I wasn't always in that position. And I could definitely see where other patients, like if my family came across something that maybe like a doctor posted about my case online, if it wasn't positive, like that could not only affect me, but my family as well. So I definitely think that there's an area to be careful around there.
Yeah, well, Katie, this is what an inspiring journey. I really appreciate you sharing this with me, with listeners, and just getting out of your comfort zone and just being vulnerable. And I think vulnerability is a definition of being human. And it also gives us a little bit more of appreciation and recognition to the to life and not taking anything for granted. I think that's really important. So I really appreciate you spending some time with me on Healthcare Unfiltered, and I want to wish you the best of uh, luck. And I would like to hopefully bring you back maybe in several months and just chat about something else.
Yeah, I appreciate that. I've really appreciated the opportunity, and apologize if my story was a little scattered there. There's a lot to plug in there,
No,
but I appreciate it.
it's perfect, and I appreciate you sharing it with us.
Yeah, thanks.